Welcome to RAAONLINE. So today we have a wonderful trial, that is woman trial. Okay. So whenever we discuss a trial, we'll start with a question. Okay. Only when that particular question is clinically relevant and significant, then that trial will matter for us, right? So what is about this woman trial? That is World Maternal Antifibrinolytic Trial. Okay. So this is basically about the tranexamic acid for the treatment of postpartum hemorrhage. Okay. So this is an international randomized double-blinded placebo-controlled trial. It was published in Lancet, which has a very good impact factor in 2017, and it has come in April 26, 2017. And why this particularly? DNB Emergency Medicine year 2021 paper 4 question 10 is about women's trial. Okay. So the question here is, does the early administration of tranexamic acid compared with the placebo reduce death from bleeding in women with postpartum hemorrhage? Okay, the question is, can I give tranexamic acid in women with PPH? Okay, does it really reduce death? So the background is, we know that the postpartum hemorrhage basically defined as blood loss, anything more than 500 ml within 24 hours of giving birth. Okay, we'll stick on with this definition for this trial. Okay, there are other definitions also with respect to cesarean section versus vaginal delivery. But for this trial, we'll stick on with this as definition. That is blood loss more than 500 ml within 24 hours of giving birth. Okay, described as postpartum hemorrhage. Okay, and understand this is one of the leading cause of maternal death worldwide. Okay, and the tranexamic acid reduces bleeding by inhibiting the enzymatic breakdown of fibrinogen and fibrin by plasmin. So this is a picture which depicts that this plasmin is basically responsible to kill all the fibrins. Okay, so destabilize the clot. Okay, so once fibrin gets converted into fibrin degraded products, the clot get lysed and they will start bleeding, right? They enhance bleeding and stuff. So we need to stop this plasmin activation. So eventually we need to stop this plasminogen. Okay, so that is what your tranexamic acid does. Your tranexamic acid blocks or binds the plasminogen so that plasmin is not activated. Since plasmin is not activated, fibrin is left as such. Okay, so this is the way it controls the bleeding or prevents bleeding, I can tell you. So we have another trial, that is a CRASH 2 trial, which has demonstrated that this tranexamic acid reduces all-cause mortality at 4 weeks in trauma patients. Understand this, okay? So in your exam, if at all you get a tranexamic acid, you need to describe about various trials, and one such trial is definitely the CRASH 2 trial, which has documented that there is a mortality benefit if you give in trauma patients. Okay, and a subgroup analysis demonstrated a 0.8% of ARR, that is absolute risk reduction. Okay, in death secondary to bleeding with tranexamic acid as such. Okay, so this is overall mortality is also reduced, all cause mortality, overall mortality because of any other reason also, because the composite death rate. Okay, so the composite outcome is also getting reduced, and moreover specifically in terms of bleeding is also the all cause, so the reduction in the death is also minimized. So if you see the design, this is a randomized controlled trial and it is double blinded. What is the meaning of double blinded? Basically the participant and the clinician is giving, both of them doesn't know what exact medicine are they giving with respect to this trial. Okay, whether they are getting the tranexamic acid or whether they are getting the placebo, both of them are blinded. So basically it's a sealed envelopes containing the randomized codes will be only present. Okay, and this is done in terms of intention to treat analysis. Okay, a sample size of around 20,000 patients was calculated to provide a sufficient power to detect an absolute reduction in mortality from 3% to 2.25%. Okay, there is around 25% of relative risk reduction, right? So 3% to 2.25% is reduction by 0.75. right, 0.75%. Okay, so 0.75 is nothing but 25%. 25% of 3%, right? What I'm trying to say is 0.75 into 4 is equal to 3%.